here within 5 minutes. He's just right on Crown Valley. So he'll be about 5 minutes late. So just chit chat among each other. How's that? Okay, thank you. Thank you all for coming.
Okay. Go. We'll get that going.
Hi, how are you? Yeah, they're in Minnesota, and they're just having a blast. Several practice in Minneapolis. They're 6 and 8, and they are so fun. If I have a picture, I have one coming out.
You're not going on
What's
that.
the one coming up? We're going on the 12th of February. We're going to stay for 3 weeks. Yes. But most of mine are not going. You know, it's funny you should say that because we rent a car, we pulled into the driveway, and there was still some snow, so they were at work. So I go to the neighbor and said, "Where are your snow shovel?" But he found a shovel. So he says, "Oh, I'm watching YouTube." And my kids come home and go, "Oh, are you shoveling the driveway some more?" I said, "Yeah, yeah." So, oh, why? But I couldn't find your shovel, so I asked my neighbor. I said, "You said, we have a shovel for you."
What's up, you want to sit there? You want to move that one over? Is that safe? No, you look over. Okay. And then, why don't you go in there and then I'll sit there.
Heat wave, it's gonna be in the 30s.
And I'll put your or we can start with it here, but I don't know if they'll let you keep it. They may ask to wait.
Waiting for the bus.
We were gonna sit here, but how, and can you shoot this area now? Because you don't transfer to a chair, right?
Yeah, I mean,
Well, this is,
Oh, these are all just.
it's nice to hear a little, you know, to hear something. Well, he told me there was some, my sister Linda should be at this, but she's got horrible back problems too. She is.
Okay.
Well, I mean, I've always walked with. I know that there were other parts of my back that were not as bad when I had the surgery. They were not great. You're another one of those people. This is Monica. Yeah, until she tries to get. One thing about your friend Linda, now she has such good posture. She, when you watch her, she said, "Oh, that this is something I don't know." Because you can just see the way she, just for whatever reason, she's so erect.
You're on a mission.
There's a whole folder of it. Everyone is sitting in front of you.
Gloria, right?
Hello.
I noticed when I thought
Connie, thanks.
I'm sure. But does that,
I was saying she's
Okay.
Thank you everyone for your patience. So we have Dr. Liauw and he's ready to present.
So are you going to talk about things?
yeah, I think so. I'm really, it's nice. It's actually my first time being in this
We need to be a little louder.
Can you hear me okay?
No, I don't think it's on.
I don't think it's on.
You have to turn it
I
on.
think you have to push.
Okay.
Yeah.
Much
How about now?
Much better.
Okay, great.
What's your name?
I'm Dr. Liauw, like meow with an L. I said it since high school, actually.
Finding Nemo.
Yeah, so this is a really nice, a pretty big community, it seems like. Yeah, I grew up down the street from here. I grew up in Aliso, not Aliso, Oso and Felipe. I used to live, yeah, I went to Capistrano Valley High School, so, are most of you guys all, from, like, the Mission Viejo area,
They're from
or?
everywhere.
Right.
We don't live here, we do live in Michigan, but we don't live here.
Oh, okay. Okay, very cool. Well, I'm learning about the, I always am surprised because you pass by Crown Valley all my life and I never knew this place existed,
We
so.
now have a new sign out in the front of.
I saw that being made,
Yeah,
yes. And is this I noticed, is this a Jewish community or mostly? Yeah. Yeah, I didn't, my wife's Jewish, so I didn't even know any of this. Yeah, yeah, that's right. Well, usually I have a PowerPoint, but most people just we kind of just gloss through it, and then eventually everyone just has their own questions. So I guess I can just kind of just talk very quickly, just high level. I'm a spine surgeon. I'm a neurosurgeon. I don't know if many of you guys knew the Palmers back in the day. So Palmer's, Sylvan Palmer and Jacques Palmer. I don't know if you guys, they were also Jewish, but they were Palmerstein back in the day. But Palmer actually went to Johns Hopkins, and even though I grew up here, I kind of made my way up. I went to Stanford for med school, and then I went to Johns Hopkins for my residency and fellowship training. So it was kind of like he was one of the guys that was a rarity to come from what East Coast down to the West Coast. Most of the Johns Hopkins guys stay out in the East Coast. So he was the one who actually brought me into the practice, and I give a lot of credit to Sylvan Palmer for bringing out back in the day. And I know he had a pretty good relationship with the community. So I always, whenever I ask, I always know a few people know of those two brothers. It was Jacques Palmer and Sylvan Palmer. Sylvan was also a neurosurgeon like myself, trained at Johns Hopkins. He trained probably around the time, he was a little older than Ben Carson, but that's another kind of a famous Hopkins neurosurgeon from that time. So, it's funny because I actually did train a little bit under Ben before he left Hopkins. So I trained for about 5 years, and my 5th year he left. So, I came home. I mostly I take call at Mission. I also cover sometimes Saddleback and Hogue, Irvine, and down to Mission Laguna. So I consider myself to be mostly South Orange County. Basically, I came home. So I have the privilege of serving the community that I grew up with, and it means a lot to me to be able to do that. You climb the ivory tower forever, and it's very meaningful to be able to come home and stop climbing that tower. So I kind of view myself as a regular bread and butter community doctor, even though I was fortunate enough to have trained in the best places. I felt like my surgical training was very good, and Sylvan and Jacques, I kind of inherited their practices to a large degree because toward the end of their career, they saw me operate, and they say, hey, you have good hands, and you're also a minimalist too. And Sylvan was very much a minimalist when it comes to surgery. We try not to do surgery, believe it or not. We always try to do the right thing and try to treat people like human beings and not just offer surgery right away, and that means a lot to me. I think my overall reputation in the community is I always try to do the right thing. So a lot of times people come to me for advice. Do I need back surgery? Again, we treat brains as well, but majority of the people in the community come electively for back problems, back pain, sciatic pain, And backs include the necks. So people always say I have neck pain or arm pain, or I have lower back or sciatic pain down the legs. So, I think when people come to see me, they usually say, hey, do I need surgery? And my first response, like I say to you, is no, you don't need surgery. We're here to try to treat your pain non-operatively first. So a lot of times we will refer patients to try physical therapy, which can benefit or not. Sometimes we try injections, epidural injections. There's also radiofrequency ablation. Those are performed by pain management doctors. And then if all of those fail, hopefully epidurals work. Hopefully those radiofrequency ablations work, take away your pain. It's better for you, better for me. I would rather not operate unless we had to. Only if anything fails and people say, hey, Dr. Liauw, I can't live like this. My pain is too severe. I never tell a patient they need surgery. They tell me when they want it because they've already tried everything. And that's the time when we start thinking about different types of surgeries. Again, starting from small. A lot of times, most of you, I always try to push toward doing smaller surgeries like little shaves around the nerve root. Those are called laminectomies. Microdiscectomies, small things that I would feel comfortable giving to my own grandparents. I don't want to just take you in and and do a fusion. No, we want to start with small little shaves, little things that you can tolerate that won't be very hard for people to recover from. Certainly there are some backs or even some necks where there's just too much arthritis. A shave is not enough. And sometimes in those cases we do need to do a little reconstruction, putting in a spacer in the disc, maybe a fusion, a small fusion like the 1 or 2 screws to hold the joint still if it's too loose. So, every person has a different problem. Every problem is a puzzle, and it's not a one size fits all generally. But when people come in, they usually bring in their scans, and usually we want an MRI scan to look at the nerves or a CT scan to look at the arthritis. Those are a little bit more informative than just an X-ray. And then from there, I can kind of discuss, okay, what have you tried already? Have you tried shots? Have you tried physical therapy? And if you have, and those don't work, and you're still in 7, 8, or 9 out of 10 pain out of 10, then we start to think of some surgical options, which could be a shave or a new disc or a small reconstruction. There are, just as the last thing, there are some newer technologies out there as well for patients who say, hey, Dr. Liauw, I know my back is bad. I know my neck is just is a mess. Is there anything I can do that isn't requiring any screws or rods or any fusion? And I say yes, there is always an option. And one of those options can be stimulation. We try sometimes spinal cord stimulators, and they don't work great in everybody. They work only in 50%, but we do a trial first. We put it in through a needle, and we turn it on and ask you, is your pain better? And you wear it for 5 days. Only if you respond to stimulation, and if you do, it's a nice option to have because stimulators are much easier to get in, and they're reversible. You can always remove them if they don't work after a while. So those are just some of the newer technologies that we can use to reduce, and what that does is it blocks pain. It doesn't actually fix the root cause of the problem. It's not a reconstruction of the joint, but it can certainly block pain. And hey, if that gets people walking more and in less pain and improves their quality of life, that's what we shoot for, and that's great. So I think that's overall. I always like to do like kind of high level overview. Again, when people ask me, where's my pain coming from? Pain comes from 2 places or 3 places. Think of the tissue in your body. It can come from the nerves. It can come, which is nerve pain. That's the sciatic pain down your leg, or the pain that shoots in your arms or in your scapula. Those are all zingers. That's nerve pain. If for nerve pain, we shave, we open and decompress. The second type of pain is just generalized pain across the back, across the lower side of your back, across your neck. It gives you headaches. That's usually arthritis pain. That's joint pain, okay? And then the last type of pain is muscular pain. That usually responds well to heat, and that's usually a fatigue type of pain, like your back feels tired at the end of the day because of use. And that usually interrelates with the joint, with arthritis pain, but it is a little bit of a distinction of a type of pain. It's a fatigue or muscular pain. So again, nerves, arthritis, which is the joints or the bones, and the third type of pain is muscular. And A lot of times our treatment is geared to treat one of those three. So, I kind of just wanted to open up and just, a lot of times people have specific questions about their own health, which benefits, that information a lot of times will benefit everyone in the audience. So if anyone has any questions, just feel free to raise your hand. Go ahead.
Yes, Dr. Liauw, if you have a healthy spine, fairly healthy, but there is a cyst, which I understand is fluid, right?
Yes, that's right.
If there is a cyst between the fourth and the fifth, and can it actually be helped with therapy, physical therapy, or if not, with epidural?
Yeah, I love that question. It's actually more common than you believe. There's two types of cysts. Your cyst that you're referring to is probably a synovial cyst. It's from the joint. So this is why it's good for people to come and see me with images, because I can kind of also, again, I don't view myself as a surgeon only. I view myself as a quarterback. I help guide you to who can treat it. So for someone with a cyst, a lot of times the first line of treatment is trying to pop the cyst. And actually, I would send you to Dr. Musavi or Dr. Rulin, which are our two pain management guys that we have good relationship with, and they're very good. And what they can do is they can put a needle in the cyst and suction out the cyst, and that may be a temporary fix. It may not last. It may last 2 years, but hey, that's great. In 2 years, you can get a cyst drained again with a needle and avoid surgery.
How dangerous is that procedure? How dangerous?
Very little dangerous. So the synovial cyst sits outside the spine. So what's nice is you can put a needle under, and the needles are guided by X-ray. So there are people that are like, oh, they're just stabbing me with a needle. And no. They're actually using an X-ray guidance, AP and lateral fluoroscopy, to really precisely, they can guide it right to the joint. Or they can even guide it right to the nerve. I mean, that's how precise they are now. And so they would a lot of times will drain the cyst, aspirate it, shrink it down, and then they can in fact back inject it and fill the area up with an anti-inflammatory or steroid.
Sometimes they say that the cyst can disappear by itself.
I haven't seen that too much. I mean, certainly anything and everything can happen, but majority of times cysts are degenerative in nature. So the cyst comes from an arthritic joint that makes inflammatory fluid. And as you move your back all day, more and more inflammation occurs like a pimple. It just kind of grows and sits there, and it replenishes itself. So a lot of times the cysts tend not to come. Even when you pop them, like I say, a year later or 2, they can grow back. The surgical fix for a cyst is to fix it, because it's a lot of micro motion of that joint. But again, that's a permanent fix if the drainage doesn't work.
And the cyst can become cancer?
No. The cyst, I've never seen that happen. It's just think of it like an inflamed joint. Pretty rare for that to transform to any kind of
You
cancer.
should try the epidural first.
Yeah, I would try an epidural or a cyst aspiration with the pain management doctor, Dr. Rulin or Dr. Musavi. And when you come to my clinic, I can send you there. They're in Mission. They're in the Mission Tower, the White Tower.
So this cyst put pressure in the nerve.
Yes.
Thus will produce the sciatic.
That's exactly right. The question is, does a cyst put pressure on the nerve to cause sciatic pain? And yes, and just like all nerve pain is usually a result of a secondary compression from arthritis. So what happens is arthritic joints grow. Like a knuckle joint, you see people with rheumatoid, they have big knuckle joints. Those joints grow and because they're arthritic, and then when they get to a certain size, they start hitting the nerve and causing sciatic pain. So a lot of times you try to remove the arthritis and take it off of the nerve.
Thank you. This cyst developed during the years of your life, or how?
Yeah, I always say arthritis, all arthritis, they're like glaciers. They don't just all of a sudden pop up. They develop slowly over decades, and little by little until it gets to a point.
Thank you.
Go ahead.
Once you start to get arthritis in, let's say, part of your back or in your neck or something, is there a way to stop it from continuing to get worse, or?
It's hard to stop it 100%, but you can slow it down. Slowing down the arthritis progression can be a combination of anti-inflammatories. You can try an anti-inflammatory diet. Also, just walking around. When people say like arthritis, very commonly people say when they have arthritis, they wake up in the morning and something hurts. Back, the neck. And then throughout the day, as they use the joint, it tends to start to feel a little bit better, little by little. And that's pretty classic with arthritis. So, yeah, sometimes use actually helps reduce the inflammation of arthritis. Now, you don't want to go lift heavy weights or anything like that. You want to protect your joints. But, with use and mobility, it can help slow down arthritis.
I've also heard, Dr. Liauw, something as simple as drinking enough water in the morning as soon as you get up.
Yeah.
It will hydrate.
Hydration, absolutely. Hydration, muscles tend to actually hurt more when you're dehydrated. And I think that kind of does tie hand in hand a little bit with arthritis. So staying hydrated is, and a number of these things, it kind of reminds me of the anti-inflammatory diets and stuff like that. They just help keep your body healthy.
Okay, he had back surgery, in fact, he's wearing a brace. And now it's hurting him below.
Does it hurt where the brace is?
No, when I put the brace on, it feels good.
Oh, okay. Yeah, so what happens is, the question is, what about if you've had back surgery and this starts to hurt the level below? And a lot of times that could just be, how long ago was your back surgery?
I think it's about 4 years ago.
Oh, that's a long time ago. Okay, so it could be that there's two things that could be happening. The load, so if you had a fusion surgery or something and they corrected one area, the next level below unfortunately can start to break down or at least have strain. So you could be having some strain at the level below. So sometimes heat will really help, but also just kind of core strengthening.
I think I had a growth in my spine.
Oh, you had a mass?
Right, and that's what they removed.
Yeah.
And now if I walk for more than 5 minutes without my brace, I'm in agonizing pain.
Honestly, if you're in agonizing pain, I would come to my clinic and I'd order a CT or MRI or whoever did the surgery. That's usually the next step to see what's going on, because you could have breakdown of the next joint below. Yeah, and especially if it were not agonizing, I would ignore it. But if it's really hurting you a lot, then I think it's worth an MRI or a CAT scan.
Okay.
So Dr. Liauw, if I understand correctly, as we age, if one vertebrae, let's say surgery, and then because of the stress on your body, then you can have problems with vertebrae above and below?
Yes. Yeah, think of our spines as a string of pearls. Every joint, it's different. Spine is different from the rest of the body. The knee and the hip is one joint on each side. Your shoulder is one joint on each side, one ball and socket. The spine is 27 joints. So you can fix one area or break down one area and the next one will degenerate, just like this gentleman potentially, right? Unfortunately it's a cascade. And it's hard to reverse aging, right? So once one area starts to break down, the other areas will start to break down too. And unfortunately, that's why people do sometimes have multiple back surgeries. It's not just necessarily a failure of one back surgery. It's because it could be a failure of another area of the spine. Yeah.
And speaking of hip joints, Dr. Liauw, when it comes to the hip, which I think is very complicated too.
Yes.
If you have a hip problem, not surgery yet, but can the problem go down to the knee and to the foot to cause like plantar fasciitis, which is minor compared to the hip?
Yeah, so the question is, can hip pain translate down the leg? And it can in certain ways. Most commonly, if something's wrong with your hip, you tend to have groin pain right at the inguinal area, a lot, or sometimes on the lateral side of the hip. I don't usually see hip pain causing pain all the way down to the foot. Usually that's from the back, from the sciatic nerve. But a common overlap between the hip and the back is actually groin pain. And people usually come to me and say, oh, I have this pain right here. And I say, actually, that might be your hip. That may not be your back. And then usually at that point, they get x-rays of their hip and see a hip specialist.
Does the groin pain relate to a bad hip that needs surgery though?
Could be. It could also just be inflammation around the hip joint. Yeah. Yeah.
So I don't know, is that helped by the anti-inflammatory?
Yes, sciatic, Mike, the question is sciatic nerve pain helped by anti-inflammatories? Yes, in general, there are 3 classes of pain medications we use are anti-inflammatories, which can be as simple as Advil, or you can go to meloxicams. Those are usually more for arthritis, but we can use them sometimes to suppress pain from the sciatic nerve. The other 2 types of medications we can use for sciatic nerve is narcotics, which we try to use sparingly, and then the other one is the gabapentins, or the nerve medications. Yeah, magnesium is also very good. You can take take magnesium at night over the counter, and sometimes that can help quiet down sciatic nerve pain.
But they are taking primitive
Yeah, it's hard because in some patients medication works great, and if that's the case, I would always stay on medication than recommend any procedure. It's just that when medication stops working or is not effective is when we start to consider surgery. Go ahead.
I have a pain that I can live with.
Yes,
I've
perfect.
had an epidural, but
Yes.
I've had 2. The last one wasn't as effective as the first one. But my question is, when my pain first started, I thought it was my hip.
Yeah.
And my mom had had hip surgery, so I thought, oh, that's what I had. So what you're saying is it's common that it's back pain in the spine, because that's what they told me, but the pain I'm feeling is what I call my head, right here.
I think that could be a hip pain. So
That's what
I would at least, here's what I would do is, again, you don't even need to see an orthopedic surgeon right away, because you can live with it. I would try getting an x-ray and then seeing one of my colleagues who does the pain management for an injection in the hip. It could be a bursitis, something very, very simple.
Yeah, I mean, I can live with it, but I'm just surprised that it's back pain.
Yeah. Yeah, and if you can live with it, no surgery, absolutely not. But these little injections can really tune you up and make you have a little bit better quality of life, and they're not much risk at all.
Yeah, thank you.
Of course.
How do you feel about meloxicam, Dr. Liauw? That was given to me for different parts of the body, and I don't think I could go to sleep without taking it.
It's a good
The pain
medication.
is so severe.
Yeah.
Is it, how many milligrams do you recommend?
Oh, I forgot. I don't. It's funny. I haven't prescribed
I
in
have
so
15.
long.
I have 15.
15 milligrams. That's fine. That's a pretty standard dose. I think you can go up to 30.
Oh.
But yeah, I really, meloxicam is a good medication. It's meant to be one of those medications that you can take forever and constantly. So it doesn't really affect the kidneys or liver as much as some of the other strong anti-inflammatories.
Can affect your stomach.
No, so sometimes, but a lot of times the patients are okay on it. It was actually designed to be a long-term medication. If you take Advil all the time, that can affect your stomach.
Going back to the sciatic pain,
Yeah.
doctor, the physical therapy will help or not?
Physical therapy the question is, can physical therapy help sciatic pain? And certainly yes, there are some stretches and distraction they can do. They can do some nerve glides. There are different things they can try for sciatic pain. Does it affect everybody? No. Does it help 50%? Maybe 40%. But you just hope that you should try that first, because you don't want to, again, end up on the surgical table or need anything more. You always start with simple stretching, physical therapy, and then you move to injections. And then if those don't work, then you consider surgery. Yeah.
Go ahead.
Yeah, go ahead.
How long can you take gabapentin?
How long can you take it?
Yeah.
It's interesting. It used to be, people used to hate narcotics, and people were against narcotics, so they started prescribing gabapentin.
Yeah.
Then some people started now the new media is saying, oh, gabapentin can cause dementia.
Oh, thank you.
And then I'm like, that's news to me. I didn't know that ever. This is just this year. And so it's kind of like how everything nowadays can cause cancer. It's just really hard to know what's real, what's not, but so how long can you take gabapentin? If you asked me last year, I say forever. Now I kind of tell patients, well, people are starting to report some dementia from it. So I'm like, I don't know, So it's just one of those things that being said, is it just a few case reports or is it long term?
Right.
There's not much data on it.
I just take 2 a night. I was taking 4.
If it's working, I would say continue it.
Yeah.
because the rate, the risk of dementia to me seems so low, and if it's an effective medication, I would say it's okay to take. Yeah, go ahead.
Prednisone with
Pred-
PID.
Prednisone is a harder one. That's one of those where people try not to take it for very long, unless you really need it. Prednisone can cause, thinning of the skin. It can cause some diabetes. There are some real, it can cause muscle wasting. There are some real consequences of long-term prednisone. Short-term prednisone, no problem. Just the long-term, I would ask your primary care to maybe slowly taper that down. If
When
possible.
you say long-term, what do you mean by that?
If you're taking it for like 6 months to a year, yeah, that's good. I would try not to stay on it.
But prednisone is not a painkiller.
It's a strong anti-inflammatory which can reduce pain. It is not a painkiller, but it's actually sometimes one of the most effective medications for pain because it's such a strong anti-inflammatory.
What do you recommend as a replacement for gabapentin?
People will replace it with Lyrica.
Yeah.
It's a little bit, it's a newer medication, and that's relative. By new I mean 15 years old, but it's not new, but newer than gabapentin, and they haven't really had any of those, things they say in the news about dementia. That being said, hey, fast forward 10 years later, they may say
Right,
Lyrica
right.
causes. Like that's what I'm saying. It's hard for me to know what's real, what's not,
Right.
because but Lyrica would be the alternative.
Dr. Liauw, on that note, I was changed from gabapentin to Lyrica.
Yeah.
And of course, I like very little medication, and I was only taking 1 a day instead of 2.
Yeah.
So when the doctor called me to see how I was doing, he said I wasn't taking enough if I went down to 1. This
Yeah.
is not as needed, it's as prescribed.
Yeah.
So that was an important thing for me.
I mean, I have had patients who just take it at night, so I wouldn't say it's out of the question.
Okay.
He just wants it to be effective. Now, I mean, has the Lyrica been an effective alternative to gabapentin for you?
I think it has helped, but which one do you recommend? I've tried both, but the pain is so severe that I can't, as long as I can move,
Yeah.
even with pain, nothing is gonna take it away 100%.
Yeah, there's not one I recommend over the other. I just ask the patient what's working for you. Because some patients respond to Lyrica, some patients respond better to gabapentin. Just whatever, we actually a lot of times will try both and see which one works better,
Thank you.
of course. Yeah.
Which is better, to use the ice or heating pad?
I like heat a lot for muscle. People always think ice, but I actually prefer heat because heat helps relax the muscles.
Say it again, please.
Oh, I usually prefer heat over the ice.
Heat.
Yeah.
Thank you.
Recommend marijuana.
I'm sorry, but if you have an injury that is like right then now, you have to help with the pain, ice is good, right? Because it
Yeah.
helps with
For
pain.
if you trip and fall and you have a bruise, ice is for the first 3 to 5 days. Use ice. But just for long-term pain relief, heat. Go
Thank
ahead.
you.
My parents lived here many years ago, and my mother had very severe rheumatism
Yeah.
and pain.
Yes.
And the physician, not here, but at Mission or whatever, recommended marijuana.
Yeah.
And this was 30 years ago.
I support that. Yeah.
Okay.
It just depends on, again, like any medication, it just depends on the patient. But some people really respond to it, and it's not. And for my opinion is that it seems to be a little bit more mild than even narcotics. I'd rather, you try that instead of narcotics necessarily.
And what about gummies?
Yeah, that's fine. Yeah. Like, there's no magic to a lot of these medications. It's just you have to try them and see what works for you. Everyone has different response rates. Yeah.
What would you recommend for immediate treatment? I find when I have arthritis in my spine, my shoulders, my
Yeah.
hands, and recently I was sewing all day, and the next day I woke up, my hands were all blown up.
Yeah.
Do you recommend ice or heat at that point?
I would recommend ice for something acute, like you did something that caused it. Yeah. Ice and Advil, usually not.
Is there a substitute for Advil? I've had too many problems with the NSAIDs.
Well, the meloxicam,
I ended up in the hospital.
with meloxicam too,
Mhm.
for
And
a
there's
stomach ulcer.
It was a gastritis that
Yeah.
looked like gallbladder
Yeah, then
symptoms.
you probably need to go on the tramadol.
Oh, I never did well with travel.
Yeah, it's hard. That's the thing.
Yeah.
Is like you know, people get side effects from, everyone's different, right?
Yeah,
So
tramadol.
like, something works great for someone, and then someone else gets a side, so you just go down the list. So tramadol is pretty light of that. I mean, you could try the, you know, gummy or CBD, you know, those might have less side effects. Yeah.
One more question.
Yeah, of course.
Lyrica.
Yeah.
Can it be taken long term? Because I have a
Yeah.
really bad pain. They did an ablation on my neck,
Yes.
and it's just not the same anymore. And doctor highly recommended the Lyrica. Should I take it long term?
Yeah, I've never had anyone have a problem long term with Lyrica.
Okay.
So usually that's one of those that is okay long term.
Thank you.
Of course. Yes.
Do you recommend Tylenol for pain?
Yeah, Tylenol for
Is
pain is
that
one of my
what-
favorite.
Yeah.
That's actually one of the lightest ones.
So
And now they have
much
Tylenol.
president.
Yeah, now they have Tylenol. Yeah, and now they have Tylenol arthritis.
Yeah,
Yeah,
Very
which is a
Yeah,
little bit
that's what I take.
perfect.
that's a good thing.
And it's over the counter, so it's easy for patients to get access to.
Thank you.
Of course.
Is that stronger, the arthritis?
It is a little stronger. I think it has a little codeine in it.
Yeah.
Yeah. Go ahead.
Yeah, I think, so that, you know, I learned from all of you, but for me, what has really worked with severe pain is the Lyrica,
Yeah.
as prescribed,
Yeah.
meloxicam just one a day
Yeah.
after a meal, and Tylenol as needed.
Yeah. I think everyone has their preferences, and it's kind of good that you're varying it up, because that way you're not just dependent on one medication.
Thank you.
Of course.
Is that new Tylenol over the counter?
Yes,
It is.
it's over the counter.
How many milligrams a day?
That I just go by the bottle. I can't remember all these milligrams.
Much to remember.
Yeah.
They give you very good instructions on the bottle.
Yeah.
And I also asked my doctor,
Yeah.
and he told me not to worry, take 6 a day, which is sometimes severe pain.
If you need it.
Otherwise it's for it.
Yeah, if you need it.
Thank you.
Well, great. I
Thank you,
think,
Dr. Lee,
yeah.
for the offer.
Yeah. Thanks everybody for coming. I appreciate it.
Thank you.
Informative.
Yeah, so just so you know, my office is in Laguna Hills, and eventually I'll be moving back down to Mission. I started at Mission, but if you ever need to get in touch with me, my Laguna Hills office is probably where you'll see me.
Do you have,
I'll just write down my number, or I don't know what the best way. I should bring.
are you with Scan by any chance?
Yeah,
You are with Scan?
Yeah, we take scan.
Leave it with Heather for sure.
Yeah, I'll leave it with her. Here, I'll leave it up on the dry erase board.
Oh, yeah, perfect.
You guys can just write it down and just call my
Yeah,
clinic.
write it down.
Dr. Liauw, is your wife also a doctor?
No.
Oh.
Do you know a
Try for the
female
better.
Liauw?
Huh?
Do you know another physician named Liauw?
No, but he mentioned that his wife was Jewish. I was wondering if he was.
Yeah, she's more in finance.
Of course, thanks for coming. Thank you everyone for attending the talk today.
Thank you, we appreciate you doing the work.
Of course, yeah. Thank you for being so supportive and attending. Yeah.
Are you still dancing?
I know you do all this.
Thank you, Dr. Leo.
Thank you guys very much.
Okay, you
Nice to
got
meet you
it.
guys. I'll see you around. Nice to see you guys.
Bye-bye.
All right, you're gonna have to do something about it.
Yeah. First of all, I never heard of Lyrica.
Do
I
we
mean, I've
know?
seen ads for it. I didn't know it was a newer thing like yeah, they were talking about it. They said it's newer. Like Alicia Taylor, my kids got all the I don't mind it, but no, they said it was good. All of a sudden this year, they're saying things, then they go into the, one thing, but then they find out other stuff.
I didn't go to breakfast.
And also, it was an interesting way to describe it, the spine being a string of pearls of 27
He's not here now, he's gone.
joints, whereas
You got his name
everything
right
else
there.
is
All right, okay.
And so that's why
Just Google.
there's
Yeah, just
so many
Google it.
people have to have several spine
I don't think ours.
surgeries, is because the different, like, I had surgery on specific lengths of my spine.
Okay.
Like, so two pearls, let's say. And he said that more aggressive doctors would have done another one or two, because they want to study, but he's very conservative, days in age.
Second
So,
of
whether that's
February,
good or bad, it's just,
February 2.
anything you listen to, could you hear him in?
Monday.
Yeah, after a while, yeah. But even with you, when he was talking about sciatica, and it reminded me to ask you, if you was having pain, and, remember you had the bursitis shot, which really helped you with walking. So, you could get another players anytime, like you pass the point where. Because, yes, I didn't know if it was just this, but I still have that
Gloria
this hand is
on
starting
San
to
Diego.
shake again.
Long time ago.
Look at this, you're coming in.
It's not, it's
Well,
not
I know everybody.
like,
Everybody meet
but
weekends.
this, this starts,
Yeah.
which is why I'm taking that gabapentin. It's they also use it for things like related to Parkinson's.
My son's a rabbi, my daughter was a canner, and they're in Minnesota now.
That's where he's from.
Are you from there at a dock in Minnetonka? Do you know that shul?
I was a little kid when I left.
But you did go to shul.
That synagogue's 142 years old, so I
She's
think it was there when we were
Minnesota.
there.
He's from Minnesota. You went to real shows in Minnesota. There's a lot of Jews up there. There's a lot of Jews. You were a good listener. And
Yeah,
you
they,
tried.
That's where we were.
What town was that in, do you know?
What town?
Yeah.
Minneapolis.
And our kids are in Minnetonka,
Oh,
they
yes.
live in Plymouth.
I was a
But
little
they
bit
had a pulpit in San Diego for 5 years, in Poway.
but maybe they
And
want
then
as
last
many
July,
people and
over a
so
year ago,
far,
they
you
got
know,
that
what
job.
Frank Stern was there at one time.
Yes.
But
Oh, I
what was
don't think I do
interesting
that.
was when he was saying like,
He was
when they said they had a cyst, let's say, in between, which sounds really old.
I see
But
Hetty
he
all the
was
time.
saying with the advances that they
What
have,
happened was,
they
when
can
my
still
daughter was
learn
starting to go to
basically.
Smicha,
Because, we have cysts in our genetics from gas babies,
senior canner.
they can puncture it, and he said, it may not last forever, he said, but that could last a couple of years. But for a lot of people, you can have something work for a couple of years, if you have to work again, if it's not a
So they,
invasive.
I accept the fact that my
That's not,
grandchildren
you know,
are 200 miles
it's not,
from me.
it's not that big of a deal, I mean, it's always a big deal to have something,
No,
but.
I got Aliso Diego.
Yeah, I just realized,
I didn't
yeah,
see many more in Aliso Diego. Oh, there was
you know, I have a friend who's having something done with, there's something wrong with her eye, and, there's ways to deal with it, long-term and short-term, and to be honest, people that are in their eighties or nineties,
People
those
ask
kinds
your
of things
I
are.
don't know who you're talking about, but that's fine.
It's better for them to do that than go through surgery, if those things are available.
That's my last
So
Vegas
it's
game.
interesting that he's also,
Vegas paint?
he's scanned, but that doesn't mean
Las
that
Vegas.
it's like.
Wait,
Linda,
You know what, someone, I used to know
Linda
almost
here
everybody.
has scanned, but you're in different groups,
I used to.
so I don't know
Well, I
how
was,
that
no,
affects.
I was working together.
Well, they may have crossovers, but they may not, but it's a possibility, because a lot of places
I
don't
created
treat
a Jewish fund saver that we did
You know.
here.
And
Like
she
slip
knew the
over,
service.
I need to look into some of those, some of
Jewish funds
these
are good.
Yeah.
Like,
She knows the same.
insurances, because I spend a lot
like
on
Eddie
insurance.
Rabbi would know.
And I have to,
She used
I have
to run
to
the
pay for my
service.
dog's insurance, so I
Rabbis
have
went
to get a free one for myself.
And I created a slip-over service here. They asked me to lead slip-over services, so they gave me this book.
Well, that was interesting.
Published
Yeah,
in,
I
not
thought
last century, but
I
previous.
liked him, he was very, just easygoing, nice man.
So nice that Bethel took it and they used it.
Wow.
Yeah.
So,
You're still involved in that though?
so involved, just for.
So you don't want any water, I'm realizing though, a lot of the things they talk about,
Congregation for Judaism.
Yeah, that's
we really eat a lot more water than we think. And also the other thing was
Contract did
these
not get renewed.
anti-inflammatory diets, but you
Yeah.
He did not
eat
renew his
I
contract.
know,
kind of an
it's terrible.
So now they're
anti-inflammatory
gonna hire a
diet,
part-time person.
cause you don't eat a lot of
And
that.
they're looking to
Sugar,
get,
I
they
mean,
don't
we eat
have
a
a
little,
reformer,
you know,
but
chocolate.
to hire a reformer.
I know, but I
they
mean,
had a candidate
you
who's
have
supposed to
that,
come,
but it's,
we're
you
gonna
know,
get
it's
to
kind of
see him next
basically
week,
anti-inflammatory
and
diet
he's
means
pulled
real,
out.
real
So now
healthy.
they don't have
Because
another
Betsy,
one
who
in
has
the
Parkinson's,
wings.
So the
is
closest one
she's
is,
always on these
Well,
anti-inflammatory,
you
but they eat a
know,
lot of meat
Yeah,
on those diets.
what is it?
Or maybe it's
Custard.
chicken, but she'll
You'll
buy a
still see
slab
me,
of beef and she'll
That's a
eat
good
it.
trip.
No, I live in Laguna Woods now, so it's not too
You
bad.
live in Laguna Woods?
Yes, I moved in.
Okay, well, I think we should
Oh,
try
I
yeah.
that.
heard that, no,
How about that,
that's
when I
expensive.
sent out when I sent out my new address, I wrote, like biblically, like my parents before me, I moved to Laguna Woods.
Don't they have a synagogue there?
Yes, they do, it's Joe Mendelson, but it's a reform synagogue.
Are we near
You're
Laguna?
not before.
Not my thing,
I'm gonna ask her, are we near Laguna Woods?
conservative.
I'm gonna ask her.
And the cantor there, when my daughter-in-law came for a high
Oh, it's
holiday
okay, I was just
services,
curious.
and the cantor, who's now cantor at CBS, heard her singing.
Cause they have a,
Wait a
she said they
minute, I
just
gotta
have
take
reform.
you to AJR, the,
What's coming up in here?
American.
We're just sitting here after,
Jewish
none of us
something.
talk.
Oh, I
don't
can't
know
remember,
anything
it's
that's
the,
coming up.
it's the non-denominational.
No, trying to figure it,
We're
yeah.
digesting
these
It
talks.
was a lot, it was all about the spine, and it segued into a lot of other,
She's cancer.
you know,
She's also
medical
in education.
related.
She's
wonderful
Yeah, she's
Oh,
very.
really?
There you go.
She recorded something the other day, it shows her beautiful voice, but I don't wanna play it for you because it was
Well,
in
where do we
response
go
to
from
what's going on
here?
in Minnesota, and the song, the words are, I'm not okay. Oh, but it's so beautiful. Good.
She said Joe Mendelson.
Yeah, they are.
That's that Rabbi
So
Joe
I
that
would
was
like this
just here.
story, so I've contacted
Oh, I
synagogue
think
in
that's-
Minnesota, and I say, I'd like to know.
I don't know, because we went to, no,
auxiliary
remember we came in here and there was that
member
Rabbi
here,
Joe?
but I
I
want to
think
get an
that's what she
auxiliary
was
member.
talking
So
about.
they,
I liked
they write
him.
back, the woman calls me,
But
she
I
says,
figured he
I've
was
written
reform.
her. She says, we don't have it yet, but we were talking about doing a thing like that, like an associate membership. So take a number, pay what you want, we'll make you a member. I said, okay. She said, but I don't, but by the way, why do you
I
want
was
to
just
be
talking
an
to
associate member
Rick,
in
you know, the guy
Minnesota
that
when you live
fixes
in
things
in Southern
around here?
California? I said, well,
And
my
he was
son's a
asking
rabbi,
me
my
if
daughter-in-law's
you
a
needed a
canon.
passport to go
we
to
love them, we
Mexico.
love them. And we should put Max and Lee on the payroll because they've
And
attracted people.
I asked
You know what they
him
learned?
about his background.
From Max and
Okay,
Lee,
I've got
that
this.
it's okay to
I
go in and
asked
out
him
of
about,
services.
and I could let go of
And a
it.
grandfather said,
And
I want
he
to bring
said,
my
well,
grandchildren, but I didn't know it was
I was
okay.
born here,
So
I'm
Oh,
an
he
American
brings his
citizen.
grandchildren.
And when they
But
get,
I don't think they go in and
He's
out.
no, he hasn't
And
been
they've
back, but
attracted all
Hispanic
these people.
heritage.
And Max has
And I
already
guess
picked
they
out
were
his
gonna
bride.
go to Mexico, and I said,
They were,
I don't
How
know
old
if
is he?
I had a
6.
background from
they were,
Central
this is so
America
funny.
or Mexico
This
or
little
anything. I
girl
said,
came
I
over
wouldn't
to
go,
play.
I wouldn't go right now personally, because
Supposed to be it. So she came
I don't
over
know
to
if they
play.
stop you, you know,
But it
you
was
just
like,
don't
you know,
know.
inclement
You
weather.
know, if
We
you
were
look
playing
like,
outside
if
and
you
they
look
went
like you're
inside.
from somewhere else.
you built that house.
And he was
Oh, is that
talking
the-
about someone that
No.
was
Oh, yeah, Winnie's
Italian,
house.
that
You're
had
right.
changed their
You're
name
right,
from like
you're right, I did.
the four,
I
you
made
know,
it.
the
That's a
40s or the
wonderful thing
50s,
for her
so it
children.
wouldn't sound like
I
an
know.
Italian name.
So I
And
can't
he
find
said,
the picture, but
well,
this
you
is
know,
what they
people
they
seem
drew a
surprised
picture
to hear how
together,
Jews did
6-year-old.
And I
And
was
on the
thinking
front
like about
it
Uncle
says,
Lou. who was-
Our way.
Yeah, it was
And
green.
But
Blue.
Greenberg
Tucks
probably
and
was not
Right.
really
Around way.
important.
The little
Greenberg
kid,
must
the
have come
6-year-old.
from
Like that?
whatever their
New on the
name
back,
was.
our
you
first
know.
baby.
So,
And they're holding
and
a
he
baby
was like
in the drawing.
kind of
That's where I can
surprised,
find it, it's hilarious.
you know, that, it just depends who you've
No, but she's
Who
saying
you
about
didn't
Winnie's
wanna be
house.
bothered.
Well,
They don't
no,
want-
it's
they
just
don't
who
have to
you,
get
who you
married
know.
first.
No, he just,
It was-
Look
yeah,
at
he
these
never
guys.
heard of
Look
it,
at these
but he knew
children.
of
These are
an
my
Italian that
grandchildren.
had an O at the end of their name, and they took, you
Does
know,
she look
that.
like Winnie, or am I?
No,
You
this
had
is
to
a
be,
boy,
you had to be
and this is Winnie.
a wasp.
Yeah.
You
Oh,
had to be
so-
white
so-
American, you know,
So
and,
So I did recognize, yeah.
but you couldn't be Irish, you couldn't be
Winnie and
Italian, you
Max,
couldn't
but
be
Max does like
Jewish.
How old?
You know,
They're
sometimes you couldn't be
6
German,
and 8.
you know, depending
I'm gonna show you
on the
Winnie's house.
time.
I've never seen Winnie's. Well, you're my friend on Facebook.
I think
Oh,
you and
yeah,
I
I
were
saw
talking,
Winnie's house.
so
you
I
can
was
see
thought-
yourself.
shocked
But
when I
don't
was
you
reading
remember,
how
I said that's the most creative thing I've
many of
ever
the
seen.
states had
She
German
made a
as
house
a
for her.
Don't
second
tell me, I'm
language,
the one who
like
said it.
yeah, like, and it was kind of, like she was talking about Minnesota.
I wish I could-
All these areas and like where
Oh my God, that house.
Beth was from,
I'm the one that remembered the house.
Pennsylvania.
Yeah, when the,
Very unbelievable, which.
Yeah.
I don't know in Michigan,
when, COVID hit.
but there were
and then
a
kids weren't
lot of
coming, so
places
we
in
covered
the
it, it
beginning, in
was-
like the
you could see
beginning of the
lights
20th
in the
century,
pictures.
like
I'll
in
show
the
you how it
19, like when
Winnie's
Grandma
house.
Reuben was born in 1902, so right around that time, because there were so many German
Oh my
people
gosh,
in
okay.
that,
Here's
you know,
some, this is,
like
this is
like
her, so
Pennsylvania,
this is the
like,
inside,
you know, like Doris
you
Christine,
know, she's in the frame.
her family. Wait, hey Siri, what states in the United States used to have
That's the way I
German
read
as a
it.
second language in schools?
Thank you.
But let me find an outside
But you
picture.
had an outside picture.
Got lots of outside pictures.
I remember
Oh,
when
here it
they
is.
sold me.
Okay, so this is when it was under construction. She's inside peeking out.
In
This is the
Pennsylvania,
outside, she and
do
her in
that.
there.
In well, it says,
Now I'm inside
in
the
the
house,
US,
I'm
the
painting
states
the
of North,
walls.
I mean, you can look it up
And
more, but
papering,
North
wallpaper,
Dakota and
I
South
wallpapered
Dakota
the walls.
are the only
And
states now where German is the
then
most
we
common
and
language
she's putting up a mezuzah.
after English.
Why
In
not?
Pennsylvania, which had a large
This is
German
inside,
American
she's
population,
measuring, she's gonna
German
measure. I made
was
this
long
little
permitted as
furniture.
a language of
This is something
instruction in
I
public
did this
schools.
this
Wow.
needlepoint when I was
And
in
I
college.
remember learning that in a class I was taking
She's gonna tape
online.
measure, she's gonna
When,
make sure
when
everything's
COVID
right.
started, and I couldn't,
She's sitting on a little couch I
go to
made,
school.
and her feet are
You
on the
made
coffee
out of
table.
what?
Teaching German.
Carton boxes. I took a box and I covered it with
So-
batting and then I covered it with,
Thank you, Siri.
see, here's like an better view
She
of
didn't
the
talk
whole
back to
thing.
me.
Here's a view looking into the house.
Okay, I feel like we should move from this room.
That's pretty
Okay, I was gonna look and see.
Even I used to go in
Unless
there.
you wanna just sit here.
Oh,
The chairs are
that's the
pretty
one I
comfortable.
remember.
Remember that?
Oh, yeah,
Do you wanna go upstairs and put your feet up?
That's the one
Got
I
a garden,
remember.
doesn't
an
matter.
outdoor garden.
Just for your
What a
visit.
girl.
Oh, when you said to me, I really miss
Well, then why
Wendy's
don't we
house.
go to the
This
big
is
room?
the original box.
Yeah, that's
Go to the
the.
big
I
room,
want
it's
this.
comfy in there.
This is,
And
so
the
this
sun's
one
going
came
down
from
by
a-
this
we
time,
found
so
a
it's not as
barbecue.
hot.
And the
Right.
box that came in was
Big.
huge, so I took one look at it and said,
That's a
that's
house.
a house. So this is part of the cardboard from the, but it got really deteriorated, so you're just playing
And
with
I'll
the
probably
dots,
take
you
her in a
know,
minute,
painted.
I'll take her,
painted yellow, had a door
oh,
with a
that looks weird.
handle.
Oh, it looked yellow.
Shutters,
I'll probably take her out in a minute, cause
she
she,
gotta get in it.
Yeah, she's been in a lot.
well, she drank a lot of water, that Robin
In
gave
the
her a lot
house.
of water, so.
And then we covered it during COVID,
And go, there you go.
and then Max finally got to come in when
And
he's
we're
out.
sitting too long.
He doesn't know what's going on there.
That's all right.
So they're looking out the window. This, you can't see it, but my butt is sticking out the door, cause I'm holding it. And then it started to really deteriorate.
What made it deteriorate?
It was out in the rain, if I knew.
Oh, you didn't have it in the house.
You wanna come with us? They weren't coming.
That's what, she had been in the garage.
Did you hit your butt?
How many hours did it take you to make
That's
that?
funny afternoon, we did it.
You may wanna
The
hit it
shutters
and,
are open,
do
then
you want
Max
me to
is
tell them
enjoying
at the
it.
front there that you're waiting?
Let's see the shutters.
These are
Oh,
shutters.
no, we're not to take that, I was
Oh,
just gonna,
God.
did you get it, did you press the
I've been in there
How did she get the
I
shutters
saw her.
open closed?
Oh, you did?
Little
Okay,
bit,
yeah.
Cut with a razor.
I don't know if she
Yeah.
did you see it light up? Now I saw it light up.
Pushed a hole in it.
I'll-
She
I'll
never
remember.
clearly
Maybe
cut it
over
on
there
that
we
side.
No, just
We'll
three
tell them
sides.
at the desk.
Then okay, say something.
Then I put the framing on the
Oh,
outside,
yeah,
the other
And
window.
then I remember your,
Oh, okay, good.
yeah, she got it.
oh, God.
Okay, Glenda, do you copy?
He's always been very
What's the
creative.
holiday?
Hello, Annie.
So when you stay out in
Oh, the
outside.
sukkah, our sukkah.
Then I remember your
Gorgeous
sukkah.
Yeah, we had a gorgeous sukkah. So look at this, you all three of us are in there. And then this is the inside. And then gradually you see it get worse and worse, and I keep singing that song. It wasn't crooked. but-
All right, Annie.
Crooked, wasn't crooked.
Jazz
And
is
then
going
Max,
to go
Max
on
like
the wall.
Are you gonna go there?
there and
All right.
How long did it last?
it lasted a few years, but the kids, and look what a mess it is here.
Let me wait for a minute.
Roof.
You need to clear your
So
pen.
when Max spoke, there were a couple of things here. Look at that. That was when I took it down. but
Coming down.
Max, so I didn't want Max
All
to
right.
not have a thing, I made him a rocket ship.
Oh, where's the
Give you a
mom?
little help. There you go.
Ruth Lund's children,
Very good.
grandchildren. Let me see if I can find it. Yeah, look, I haven't seen her in a while. I was just checking her recently, but I
Oh,
didn't see her.
very good, Mama.
I hate creative people.
Yeah, sure you do. She's always been like that.
I don't. If I could remember.
Here it is. So this is not, this is Ruth Lund's grandchildren.
Jonas went
I
out.
don't care whose grandchildren.
Are you ready, Gloria?
Yes.
So you're going to
Hi,
the
how are
theater?
you?
Good, good.
Let me see if I can.
I gotta go, babe.
Okay, just real fast, this is the rocket ship. Has a window and everything.
She made this for her grandchildren.
I didn't want it to feel left out, we ain't got a whole house. So, anyway, so that's my story.
Okay.
All right, beautiful ladies,
I'll see you, I don't know when.
maybe I'll see you at.
Enjoy,
Yeah, I'm gonna be gone for
It's
a quorum.
unexpected.
Enjoy.
Thank you,
I know you will.
I will.
And come back or send pictures.
Okay, I will, I'll bring back pictures, I'll put them on Facebook so you can see.
Good, then I
Are
see
you
them.
still on Facebook?
Yes, but I haven't been on.
Oh, okay.
I could go on.
Selma, what did you learn here? I wanted to come, but I fell asleep. That's all right. He was interesting. He talked about the different kinds of pain and the kinds of things that you can do for it. He said he's a surgeon, but he doesn't always say he wants surgery. There are other things that you often can do for it. So you go to a guy like him, and he looks at the problem, and it could be, and he explains various problems, joints, sciatica versus arthritis versus whatever. I've got them all. Yeah, and he said, very often you find you get up in the morning and you're in a great deal of pain, but if you walk around, you feel better. I call it your oil, putting oil on the joints. But that, he said, I thought it was only me. He said, no, this is true. So that's a good thing to do.
Did he say anything about the atmospheric pressure like today?
No.
Like it's gotta rain.
Nobody
Maybe
asked
5
about,
days.
nobody asked about that. I thought of it, I would ask him. But he talked about, the causes and the difference and the fact that there are different things you can do. And you start with this, and then this. He says, I don't believe that you just, I'm a surgeon, I don't believe you start with surgery, you end with surgery. When there's nothing else to do. The first thing you do is this, and if it's this, you go to the pain doctor, who can do something much simpler.
Physiatrist.
He was very different than the morning one. Did you hear the morning one?
I was having blood taken in prison.
Taking blood?
Taking blood.
I thought you were giving blood.
Not giving, no.
Not here.
I'm having, taking blood.
They did it here? Oh, I see. You keep
It's
pointing.
gone. Oh, I don't know what direction I pointed.
Okay, but not here.
No, I have to rub it out.
Yeah, so,
So what was the morning?
he was supposed to talk about
I think it was heart problem.
heart trouble.
Yeah.
He talked about what's wrong with medicine and how the doctors who make a lot of money,
This is
how
how
to
they
settle
go
down.
down.
Well, first have to turn it.
And that one should go
Yeah.
down.
He said, the whole medical industry basically stinks. Doctors,
These days it does.
doctors are working to make money. He said the surgeons and the specialists They like to make a lot of money, but I don't do that. I'm a doctor, and I just drive around in my Ford. He is? Yeah.